Hey there and welcome. It is good to have you with me today. Today, we are going to be talking about the process of doing an iris assessment, the first three steps of layering info. So, this is a really important topic because so many iridologists don't do this, and it means that they're working way too hard. Now, I happen to like working smarter, not harder. And so that's why I teach these classes. So I'm curious, this is going to help me to kind of refine this web class on the fly. What background do you have in health? Do you have any training in iridology already? Drop that in the chat box and let me know if you're brand new, if you've got some training and maybe what type of iridology you've been practicing. Or are you fully trained and you're just here to embellish what you already know? I'll give you a minute to drop that in the chat box. And if you're perfectly new, that's great. Sherry's got training in iridology and sclerology. Welcome, Sherry. April is brand new. Oh, we've got the full spectrum. I love it. Okay, so we're going to be making sure that our new people don't get lost. Okay, new to learning iridology, says Christina. Fantastic, so good. Thank you for that. So then I need to also know, if you're new to iridology, do you already work with something like herbs or nutrition or flower essences or aromatherapy or something like that? Do you do some kind of therapeutic protocols? I'm mostly talking about, are you doing these with professionally for other clients, for clients? If you drop that in the chat box, that will also let me know how deep and what direction I need to go with this. Give it just a minute to get that into the chat box for us. Ah, April, love that your nutritionist looking to add to your practice. Nice. Christina says, I'm not doing it on a professional level yet, but well-versed in many modalities. Love it. Love it. So Christina, if this was a private conversation, I'd ask, what's holding you back? You've probably got a lot to offer. So I hate to see people holding back. I like them to get out there and get at it. So whether you're new to iridology or have been practicing for a while, here's the problem we are going to start solving for you today. When we work with clients, we need to do an intake, right? We need to figure out who they are, where they're starting from, what their issues are. Now, I know practitioners who use anywhere from 4 to 20 pages in intake forms. How much time do you think that takes the client to fill out? And how long does it take the practitioner to go through all of that paperwork? The real question I want to ask you here is, what do you think gets missed when we use questionnaire style type intake forms? What do you think gets missed when we give our clients these lengthy forms to fill out? Or what do you miss putting on a form when you go to a practitioner and they give you a lengthy form to fill out? What gets missed? Those of you who are already practicing, I'd love to hear your input on this. I have my opinions of what gets missed. Their nutritional habits, yeah. They might not be putting down accurately their nutritional habits. That's a good one. That's a good one. Anybody else have something to throw in here? The thing that I see that gets missed, there's two things. Number one is the detail. My experience has been that I don't like filling in forms, and my clients don't like it either. Christina says they get overwhelmed and may miss important details. Absolutely. Absolutely, Christina, good point. The other thing that gets missed is the nuances. So often the message we need to hear from our clients is not in just the words, it's the how they present it. It's their inflections that'll often tell us as much as, if not more, than the words actually said, right? I've often asked a client, as I'm looking at their eyes, do you have any joint issues? And they'll go, no, but they'll touch their knee. And I'll say, did something happen to your right knee? And they're going, oh, yeah. Oh, yeah. I've got a problem with my right knee. They've got a joint issue, but they forgot it. Their body language exposed them. And now I can follow up with that. So one of the things that we miss when we give our clients lengthy forms is the nuances, those little subtle clues that help us to really get to the core of things. So just as a sidebar, for anybody who watches this on the replay on YouTube, remember to drop a comment, give it a like, subscribe to the channel, share it with a friend, help us get these videos to be more visible. So important. All right, so quick introduction of myself, and then we're going to start diving into things. My name is Judith Codd. You might already know that because you're on my newsletter list or you're on one of my social media platforms. I've been studying holistic health since the late 1970s, and I don't look a day over 25, right? And so I've been coaching and teaching holistic health since the early 1980s. You can do the math. I'm a master herbalist, natural nutrition clinical practitioner, and an International Iridology Practitioners Association Level 3 certified iridology instructor. My original training in iridology over 4 decades ago was strictly Jensenian. Now, don't get me wrong. I'm really grateful to my iridology teacher back then for getting me started. But iridology in North America was still in its infancy. And I ran into 2 stumbling blocks over the first few years. The first was, and this is something, this might be why you're here today, is it was taking me hours to do an iris assessment. I was working a lot of unpaid overtime to write up these detailed reports highlighting everything I saw. And number 2, even though I was doing iridology with my clients, or because I was doing iridology with my clients, I was giving them a lot of recommendations. We're going to talk about that a little bit today, probably too. My clients were feeling better, but I'd been told their eyes would change. And their eyes didn't change. They did not change the way I was told they would. But my clients were feeling better. So that kind of was a little bit off-putting as well, until I learned constitutional iridology. And that's where we're going to focus today. Constitutional iridology is more accurate and it's easier to use than Jensenian iridology. I've created a way to get iris assessments and programs. Sorry, I just was distracted here. Just hang on a sec. We've got somebody who's trying to get in. Okay, back to where we were. My apologies for that. I've created a way to get iris assessments and programs developed during client sessions. So if you are working with clients and your sessions are normally 60 minutes or 90 minutes long, it's easy to incorporate iridology the way I teach it into that time and have it save you time on the intake and protocol creation process. So rather than making your appointments longer, it makes your appointments actually more intimate, helps you get to the core much more quickly. So a huge part of what I teach is what I call layering up information. So why is this important? Well, applying these first 3 layers of assessment really only takes about 2 minutes, maybe less. So we get past the initial, hi, hello, how are you? What would you like my help with? A bit of diet information, a bit of family history, surgeries, medications, because we need all of that, right? We need that foundation. And once we've got past that, then we can get into the 3 layers. And it's important because this gives us really, really deep information. Just hang on a sec. I need an assistant. There we go. Okay, my apologies for that. It's important because this speeds up the assessment. It helps you laser focus the questions you need. I'm going to close that window down. There we go. The questions you need to ask. No more shotgun patterns of questions, because that's exactly what a questionnaire is, right? It's everybody gets the same questions. That's a shotgun pattern. When we do iridology the way I'm going to teach you today, it helps you laser in. You're asking questions that are directly relevant to your client. The second thing it does is it helps deepen our understanding. It helps us to connect the symptoms and the imbalances to identify the root more quickly. The third thing it does is it guides the recommendations we're going to make. Maybe you run labs, and if you're in nutrition, you might have the ability to run some of the alternate labs. And what you will find is that the eyes will help you shortlist the labs you need to run. Now, that's important because those extra lab tests are expensive. You might have clients giving you some pushback over running tests, $300 and $400 and $500 worth of tests. They might not want to do that. They might not have a benefits package that will cover that. And so if we can guide the tests, if we can cherry pick the tests that we need to run, or if we can't run tests, we can cherry pick the recommendations and the things we want to focus on. That's going to be good. We can also use those labs to give us more detail about what we found in the eyes. They're going to bounce off each other, right? But again, if you don't use labs, you can use iridology to help you move into protocol creation more confidently and quickly in the first appointment. How's that sounding so far? Is that sounding like something that might be a benefit? What do you think? You will find the more you play with me in my chat box, the more you're going to get from me. So there we go. April says, yes, fantastic. Thank you for that, April. So are you ready to look at layering and how this works? Christina says, yes, more efficient. Absolutely. Efficient without losing heart, right? That is so important. Efficient without losing heart. It gives you more time to create connection. And that's what our clients are missing, right? That's what we hear so much from the people who come to see us. I don't know what it's like where you are. Where I am, there is a shortage of doctors. I've just decided I needed to find a new family doctor because my former family doctor, the one I actually loved decades ago, he was brilliant. We got along on so many levels. He retired. Then I went to another one who had his license suspended. Red flag. And then I got another one who sounded really good, but he, since COVID, he does 3 months of telemedicine and 1 month in the office. So if you've got something that needs to be seen, but he's on telemedicine months, he says, go to a walk-in clinic. Where's the continuity of care with that? It's not. So Christina says major issue here too in BC. Yeah, I'm in Alberta, Christina. So we are echoing the same things here. And so what we find with doing iridology the way I teach it, because it gives us time to build that connection with the client, and we're spending an hour or an hour and 15 minutes, maybe 90 minutes, depending on what you do in your sessions. Clients leave my office saying, I come to see you because you listen, because you hear me. Instead of walking in the door, looking at the computer, saying, yep, what's your problem? Yep, here's the drug, goodbye, right? So this doing iridology this way builds connection, and that's what we want that so much. So there are specific steps to doing the iris assessment quickly and well, and I call these layers. Before we get to layers even, again, we must have at least a basic personal and family history from the client, give context to what we see in the eyes. This is conversation. This isn't forms to fill out. I'm doing the writing, not my client. I'm asking questions. How are you? What would you like my help with? Are we, what's your diet like? What's your exercise pattern like? What's your stress like? What's your family constellation like? Some things that we can get covered fairly quickly, maybe a half an hour conversation, right? But I'm hearing my client and I'm asking questions about what they're saying. Now, in the Jensen style of iridology, I was taught to totally ignore all that, to just sit down and look at their eyes and tell the client what was wrong. After 10 years of doing it that way, I found out it didn't work well. The eyes show us inherent predispositions, not absolute guarantees. So we need to think of what we see in the eyes as being epigenetics. We've all got genes that are either turned on or turned off. And the kinds of things that turn our genes on and off are how much sleep, what is our nutritional status, do we have enough of this vitamin, too much of that vitamin, not enough of that vitamin, what's our stress level like, what's our exercise level like, and yes, what is our gene pool like? So there's a lot of things that affect how our genes manifest. Changing diet and lifestyle and supplements can change which genes are turned on or off. These things don't change our genetic structure, they just change which genes are actively being manifested. So that's an important thing because our symptoms are often created by which genes have been turned on and which genes have been turned off, right? So when we look at irides, we see what areas of the body the genes want to affect. Whether those areas display symptoms depending to a large degree on what the person is doing or not doing for their health. We're going to correlate what we see in the eyes to their symptoms with their diet, with their lifestyle. That's going to help us understand why they've got these symptoms from an epigenetic perspective. The irides show us which areas want to misbehave and if they don't get well cared for. But the eyes don't show us where the problems are right now. The iris doesn't. The sclera does, but the iris doesn't, and we're focusing on iris today. The symptoms tell us what's going on. The irides tell us why. That makes sense? So the eyes don't actually give us answers. They give us the questions to ask. So these are the eyes of a female in her early 60s. We'll call her LB. Her symptoms when she came into me, she's got a history of lymphatic swelling that was difficult to resolve, irritable bowel syndrome, and candida. She's got a lot of stressful family dynamics going on that have been going on for quite a few years, and there's no immediate sign of these problems abating or resolving. She always feels exhausted, and really so much of that is from the stress, and she wants to feel joy. She wants to have energy to do the day-to-day. That's why she came to me. She wants to feel vibrant again. Her cholesterol level was 5.92. Normal is 3.62 to 5.15. Her LDL was elevated at 3.72. Normal is 3.34, but she's postmenopausal. And it's quite normal for postmenopausal women to have slightly elevated LDL. Doctors don't like it, but it's normal. It's not necessarily a bad thing as long as it doesn't get way out of hand. Her hemoglobin A1C was good at 5.1. The healthy range is 3.0 to 5.7. So she brought in her labs, and that was helpful. Her diet's pretty good. There's always room for improvement. I don't think I've ever seen anyone who had a perfect diet. So we had something to work with there. Now, as I go over her diet, and for those of you who have nutrition backgrounds, I want you to listen carefully to what she had in her diet. I want you to write it down. I hope you brought a pen and paper because I'm going to ask you what you think of it. I want your assessment of her diet just in general. She starts her day with 2 mugs of lemon water. She follows that with a cup of coffee. And then she has a green smoothie, which she builds on a plant-based protein. So she's got a plant-based protein shake powder, and she builds her green smoothie on that. Lunch is usually some kind of chicken with quinoa or hummus, a Greek salad, and maybe some cooked vegetables on the side. Dinner is often fish. They really eat a lot of salmon in their house. And sometimes there might be some chicken. There's not a lot of beef, no pork, and more veggies. She does do fairly well with her veggies. In the evening, she often will snack on fresh blueberries. She likes homemade soups. So, if she's not doing the things that I've already mentioned, she will have some soup. And she likes to make the soups. She eats minimal dairy, very minimal bread and grain products. Okay, so I want to know, what do you think of her diet? What do you think of how she's eating? I'm just interested in your perspective here. I'm not going to say you're right or you're wrong. I just want to know, what do you think of her diet? Give you just a minute to put in if you think it's good, if you think it's bad, do you think it's deficient? What would you want to see her change here? The eyes really can guide us really nicely when it comes to diet. Christina says would be great to eliminate the coffee for her adrenal health, especially with the stress levels. Oh, I agree with you 112%. Sherry says lemon water in the morning is good for lymphatic and kidneys since she is blue-eyed. Nice recommendation there. We can see your iridology training showing through. Nice, nice. Kate and April, any input here? While you're typing, she's not got any surgeries in her history, and she's not on any medications. She has used supplements for many years, and she typically chooses better brands. She brought them in. I always ask my clients to bring in medications and supplements they're currently using. So she's not using the big box cheapo brands. She's using decent brands. April says, I agree about the coffee, especially since that's how she's starting her day. Right on. So good. So good. So we'll talk more about what I recommended for her as we build the layers. So once I've got this basic information, her history, health history, family constellation, diet, lifestyle, stress levels, things like that, then we can move on to the first layer of information. Same pictures. We're just going to keep seeing these same pictures over and over and over again. So layer one, we need to determine what her primary constitution is. Now, if you've been with me for a while, you've seen the video or you've been to a web class with me about the 3 constitutions. If you haven't been with me for one of those yet, you can catch a replay right here. I'm going to give you a link in the chat box. You can grab that, copy and paste it into your notepad. So to determine the primary constitution, we ask, is this a blue eye? Is it a hazel colored eye, or is it a true brown eye? Each of those 3 categories has its own metabolic tendencies. The entire rest of the assessment rests on the primary constitution. This is the most important piece in an iris assessment. So this client is lymphatic constitution. So she has the blue eyes. Yes, Christina, she has the blue eyes. She is lymphatic. So we immediately know that she has a tendency to be over acid in her tissues and her blood, not her stomach. Really be clear about this, not her stomach. So let's begin integrating what you already know about anatomy and physiology and symptomatology. So let me know in the chat box, what symptoms might you see in someone who systemically is over acid in their body? Too much acid in their blood, too much acid in their lymphatic fluid, in their interstitial fluid. What are we going to see? We might see joint pain. Good one, Sherry. Yeah. Edema. We might see that. Okay. What else might we see? Maybe skin rashes. Yeah. Kidney issues. Yeah. Yeah. Add to these great lists that you're typing in. Nicely done, by the way. Add to that disturbances in any mucous membranes, right? Because we excrete excess acid through kidneys, absolutely, and through every mucous membrane in our body and through the skin. So through any epithelial tissue, right? So we've got to be aware of that. So questions to ask her would be, are you aware of any inflammation in your body or excess mucus production? Oh, and there you go. There's the link for those of you who need to screenshot that. Take a second and grab that. That's the link to the recording on the 3 primary constitutions. That's layer one, knowing what your primary constitution is, because if you know this client runs over acid, she's coming in low energy, low vitality, you're starting to connect dots. You're starting to think about, how does this play together? So layer number two is to determine her subtype by color, which is also known as constitutional subtype. Now, there are several subtypes by color, and a person can have more than one, or a person might not have any, and the subtypes by color are dependent upon the primary color. So we've got primary is lymphatic. There's a set of subtypes that go with it. The mixed eye or the hazel eye, there's a set of subtypes that go with that. The true brown eye, there's a set of subtypes that go with that. So very clearly defined by that primary color. So the primary constitution, again, is the overarching constitution. And within that constitution, we've got the applicable subtypes. So the subtypes in the lymphatic constitution, like we have here, are over acid. And in this eye specifically, we've got over acid. We've got a bit of a scurfrim. And we've got hydrogenoid. This is also hydrogenoid here. So these are the three subtypes we're seeing in this eye. Now, another blue eye might have different subtypes, likely would have different subtypes. There are more subtypes to choose from, but this set of irides don't have the other ones. So each of these subtypes adds more refinement and depth to what we learned from the foundational constitution. Are you hearing that helicopter outside? He's circling around a bit. If you are, I will shut my window. I think we might be okay. Great, good job. Excellent. Okay, so this set of irides, again, is slightly over acid. We've got a teeny tiny bit of very mild uric acid diathesis where we've got a tiny bit of yellow coloring in here. We've got some hydrogenoid. So this is telling us about the lymphatic system, genetically about the lymphatic system. And we've got the scurfrim, which again is telling us about how the body excretes toxins through the skin. Each of these makes the lymphatic constitution tendencies stronger. And that increases the likelihood that we'll need to do some general lymphatic system support as well. So literally lymphatic system, right? Getting the lymph system to flush better. Think about what you know. Yeah, predisposition towards lymphatic congestion, Sherry, right on. Not a guarantee of, but a predisposition to. The fact that she's had a history of lymphatics that swell and don't release suggests that we might need to get in there and do some serious work on this, right? If she did not have that symptom of lymphatics that get swollen and don't release, then we might not have to do anything too drastic with this. So think about what you know about symptoms of overacidity. Again, not in the stomach. Think about those symptoms. It's highly irregular, first off, to see someone be over acid in their body and over acid in the stomach. It's pretty much an impossibility. They are mutually exclusive. So we will never see a truly over acid stomach area with a hyperacidic constitution. So when we see these symptoms that we might attribute to being over acid, we need to take some action, right? We're going to look at another layer of information first. What about if the lymphatic system's not functioning well? What might we see beyond the obvious swollen lymph nodes? What might we see with that? Okay, that helicopter's driving me nuts. There we go. So what might we see if we've got a swollen lymph glands? What would be a symptom that the client might come in with a lower immune system? Yeah. We might see that the immune response is not good. And it might not be that the client is sick all the time, but it might be that they always feel like they're on the edge of getting sick, a higher white blood cell count. Yeah. So we want to watch for these kinds of things as well. Layer 3 is all about the fiber structure. So we call this the subtype by structure. So we're ignoring everything we've said about color so far. We are simply looking at how the threads in the eye are sitting. Now, these are not going to move. These are genetically determined, just like the base eye color is genetically determined, just like the predisposition towards being hydrogenoid and to having a scurf rim and to being over acid. These are all epigenetics. This is all how this body is programmed, right? So when we are looking at how the fibers are sitting in the eye, again, there's 4 different structural subtypes that can apply to any eye. And a person can be up to 3 of them. The fourth, if they're the 4th one, they will be only the 4th one. And so the 4 subtypes are neurogenic, anxiety tetanic, polyglandular, and connective tissue. Each of those has its own traits, and some of the traits are physical, some of them are emotional, some of them are metabolic. So these eyes are what we would consider primarily mild connective tissue, right? Connective tissue means that we've got lots of wobble in the fibers and lots of gapping between fibers. And we've got lacunae that are sitting not close to the center of the eye. She has an undercurrent, though, of polyglandular. Okay, so connective tissue means literally what it says, that her connective tissue glue doesn't hold itself together very well. She's going to be more prone to structural issues. Now, it's a very good thing that she has been extremely active all her life and in sports that are quite controlled. For example, she was a ballet dancer. She's been a competitive figure skater and a figure skating coach. She had sustained some injuries over the years, but they've healed really well because she did the right care for them. Because she has that polyglandular the connective tissue undercurrent, she's always going to have to be a little bit careful. Now she is a competitive ballroom dancer. So she's staying active and she's being very careful to protect her joints, keep her muscles strong so that she can protect everything. Now, she also has this polyglandular undercurrent, which is these lacunae that are close to the center of the eye. Now, these lacunae tell us that her hormones want to be out of balance. Oh, right, that's endocrine. Oh, somebody mentioned coffee and adrenal glands earlier. Nicely done, because that's going to be a weak link here. She's not having any problems with menopause, but those adrenal glands are not happy. So we're going to need to be very careful with her endocrine system and nurture it and support it. And that's going to be a lot of dietary work that we are going to do in steps and stages with her. She has a lot of little dietary infractions, a glass of wine here, the coffee in the morning, an occasional little treat here or there, occasional being every couple of days. She does them a little more often than she should. And so this is all going to contribute to why her energy is struggling. So questions that these eyes want us to ask. How well do you heal after an injury? What are your hormones and or energy levels doing? We kind of got that from our initial energy is low, feeling stressed. This is where labs can again add some specific clarity. So I asked her to get a hormone panel done through her medical doctor, and she's postmenopausal, so we might want to ask some questions about that as well. The adrenals are so important in the menopause phase, in that postmenopause phase, so important. Okay, so we've got our 3 layers. Now I'm going to throw in a bonus layer here, right? We've got our primary constitution, we've got our constitutional subtype, and we've got our structural subtype. If that's all you really know about your client, you can do so much good for them. Because from those 3 things alone, you already understand a huge amount about their chemistry, about their predispositions, about how their body wants to go out of balance, about what it needs to stay in balance. So as a bonus layer, we can look at pigments. When we see little washes of color, There's a tiny little pale one down here, another little one up here. And little is just as important as anything, right? When we have these little washes of color, these little freckles of color, they give us information. The color of the pigment teaches us which organ or organs inherently want to be out of balance. The placement of the pigment tells us which organ is going to suffer for that. Okay, so we could have extra patches of white, yellow, orange, rust, red, brown, black. In this case, we've got pigments that are the color that talks about pancreas. So saying pancreas wants to run the show. Well, if the pancreas is out of balance, energy will suffer. Interesting. This is saying genetic predisposition to being out of balance, for that pancreas to be being out of balance, and that it's affecting the digestive system. Pancreas is also about the joy and sweetness in life. While she works really hard to see the positive, she's got a lovely daughter who's got a beautiful grandbaby for her. That's a joy to her. The relationship with her own siblings and with her mom and things like that, not so good. So she tries to focus on the positive, but do you think that maybe the things that are happening around her are affecting her pancreas and making it harder for her to feel the joy and find the sweetness? What do you think? How much impact do you think emotion has on how our bodies work? Christina says, absolutely. Yeah, huge. Yeah, so huge. I totally agree with you, Christina, so huge. So when we combine this pigment type, that pigment color, with her polyglandular subtype, right? So we've got that predisposition towards endocrine imbalance, and we've got that pancreas wanting to be a little bit of a brat. We've got two indicators that her pancreas may not want to play nicely, in spite of the fact that her hemoglobin A1C is in the healthy range. Now, pancreas is not playing nicely. That can have an impact on cholesterol, right? And so we need to get her emotions and her pancreas under control if we are going to get her cholesterol under control. Does that make sense? So this isn't just about cutting out, well, what would the doctors tell you to do? Cut out your fats, cut out your alcohol, right? They would say no more butter, no more eggs, no more well-marbled meat, right? When I think this really has more of an emotional undercurrent, right? So if I'd seen her 5 or 10 years ago, I would have started coaching her on pancreas support in an effort to prevent her cholesterol and triglycerides from going out of balance. We would have talked about the importance of protein 3 times a day. We would have talked about the importance of joy and fun and finding the sweetness in life, right? We would have talked about anything that could bring that pancreas or keep that pancreas in balance, because 10 years ago, these family politics had not erupted yet, right? Now we're doing remedial work to get those numbers back in line. And for the record, again, I'm not going to push to get her LDLs down too much. LDL naturally goes up in postmenopausal women. And as long as it's not way out of line, I'm not going to sweat it. I think if we get her, as we get her pancreas coming online, get her feeling more of the joy, get her to let go of the disappointment and the sadness that she's feeling over the family relationships that aren't working, I think we will see really good results with her triglycerides, and we'll get everything in balance the way it needs to be. So where does all this take us? Knowing that she has a history of lymphatic swelling that was difficult to resolve, and a history of IBS and candida, I would dive a little deeper to specifically check out her digestive areas, which is exactly what we're pointing at here. This is all stomach and intestine in here. And what we see here is that her nutritive zone, her digestive zone, is very compressed genetically. She hasn't done this to herself, but it means that there is an inherent tension in her GI tract. Doesn't that track well with IBS? How much IBS is triggered by emotion, right? So that's one thing we need to work on. There's several indicators, we don't have time to go into all of them, that suggest she doesn't digest her protein well. So we need to give her some support. She needs to eat more protein. But if we give that to her without supporting her protein digestion, that protein is only going to ferment and elevate her systemic acid. Does that make sense? Yes? All right. So questions to ask her at this stage are you burpy or farty? Are there foods you've learned to avoid because they don't feel good in your system? So with this client, depending on how she's answered those questions, again, we're going to do some diet cleanup. I tend to not like to do clean sweeps. I think doing clean sweeps is way too hard. Clients can do it for maybe 36 hours and then it's just too much, too hard. They stop doing it. They get no benefit. I would rather have them do 1 or 2 really precise changes, lock that in as lifestyle over the next month, and get some benefit, some progress. And then we can add 1 or 2 more changes until we get the diet where it needs to be. How do you feel about that? Doing diet work slowly and methodically rather than here's everything you need to do, go home and do it. Slow and steady wins the race, Christina. I agree with you 100%. 100%. Yeah, much more sustainable. Yes, yes. We don't want to do things where our clients feel like they fail. Because if they fail, they're not coming back. Right? If they can come back and say, I did really well. I hit those protein targets like 80% of the time, then I get to go, yes, that's what we wanted, right? Yeah, more protocol adherence for clients too. Yeah, absolutely. Absolutely. That's what we want. So clean up her diet. Our first step, because she was getting about 25 grams of protein in her morning shake and about 25 in the evening, but she needed more. So I asked her to make sure that she had some at lunch. I wanted her to really watch and make sure she was getting at least 25 grams per meal, and ideally 1 more 25-gram snack. I wanted her pumping her protein up to about 100 grams a day, which is a lot. It's a lot for a lot of women. But again, could she digest it? Her eyes say probably not. So I needed to give her some betaine hydrochloric acid to take with that protein. No sense in getting her to eat more protein if she's not breaking it down. I think was it Christina or April who said earlier, was it Sherry, who said earlier, ditch the coffee. Yes, yes. Now I liked your reasons being that that was you, Christina. Thank you. I liked your reasons that the caffeine would be hard on the adrenals. Caffeine or coffee, not caffeine, but coffee is also really hard on the stomach lining and reduces the stomach's ability to secrete acid properly. How counterproductive is that? It is also diuretic, which means it's going to suck B vitamins right out of her. She needs her B vitamins. She really needs her B vitamins. We don't want her taking good B vitamins and peeing them out, right? So getting rid of the coffee was the next thing. Those were the 2 things I asked her to do on her first appointment. That's all. I didn't change anything else, just those 2 things, because I felt that with those 2 changes, she would see the biggest result. Okay, so I'm being a little bit egocentric here. Why do I want her to get good results? Well, because I want her to feel better, absolutely. But it also shows her, and this is going to sound a little snotty, but it's what we need to be aware of. It shows her that I know what I'm doing. And that earns her trust. And she keeps coming back and back because I've earned her trust, right? Our clients need to see that we know what we're doing, right? I find it's very difficult for clients to eliminate coffee. How do you coach them to cooperate? Sherry, that is a brilliant question. I get them to do an experiment. I will ask them, Do you think you can cut out coffee for 10 days? And most of them can. Most of them have done that a few times in their history, right? I'll say, yeah, can you cut it out for 10 days? You can replace it with a roasted dandelion root tea, one of the coffee substitutes, a mushroom coffee, as long as it doesn't have any coffee in it, right? And I'll say, I want you to do that. Can you do that for 10 days? Are you willing to do that? And they'll go, yeah, yeah, yeah. And at the end of 10 days, go back to drinking the coffee and let's see how you feel. I've only ever had one person in 45 years, one, count her one, who did the experiment, came off the coffee, felt better. They've all felt better, but I've only had one go back to drinking coffee because she liked it so much. The others come off it, they start to feel better, their digestion is better, their head is clear, and they go, when they come in, I'll say, and how did it feel when you added it back in? They'll go, well, why would I do that? I feel so much better without it. Had I known how it was negatively impacting me, I would have stopped it years ago. So when we say, ask them to cut out coffee, what they hear is that is forever. Forever is a long time. And gosh, if they enjoy their coffee, it's too long, too long. But 10 days, that's doable. They can do anything for 10 days, right? And so that's what I do. And it works really well. The number of people who come in and tell me, oh, my gut feels better, my head feels better, I'm thinking better, my joints feel better, right? It just works great. And methylated B vitamins for her for better absorption. Yes, that would be where we would go on a future appointment, or maybe we would do that on the first appointment if I felt she needed them right away. But this is what we did to begin getting her energy back, right? We started taking care of the symptom, getting her energy to come up. And from there, now she trusts me. We continue to work. We use the same set of eye photos. I shoot eye photos once a year with my clients, looking for primarily things in the sclera. There are some things that epigenetically will surface in the irides over time. So I'm looking for those kinds of changes as well. So did you notice something that I did not do in this assessment? Now, this is a little bit tricky. Is there something I did not do in this assessment? You might have to know iridology to recognize what I did not do. It's a little bit tricky. Oh, pupil shape, you're right. We didn't talk about that. That would be even more advanced. You didn't look at her sclera. Exactly. I didn't look at her sclera, but there's something even more advanced that is, or even more basic, that is just about the iris. I didn't use an iridology map at all. I didn't go to a map for one thing. I didn't start looking at individual organ reaction fields. We don't do that till appointment 3 or 4, maybe 5, maybe never. We sometimes don't need to go into that kind of slice and dice kind of detail, right? I found when I started doing iridology that using a map too early in an assessment led me to start nitpicking on tiny details that didn't mean anything for the right now. It meant that I was coming up with a long list of markings and a long list of recommendations that was overwhelming, time consuming for me to write. It was often taking me an hour or two to write an iridology report. I do not do that anymore. Haven't done that in years. But it also meant the list I was giving my clients was overwhelming. And it didn't make sense. And they're going to cherry pick the easy things, not get the results, because they're not picking the things that are the real starting points. So that they weren't getting quite the progress we wanted them to get, right? So there you have it. The layers of an iris assessment, the first layers, the most important layers of an iris assessment, even with all my chit-chatting and explanations, still took us, and with the issues we had with helicopters and somebody who was having problems getting in, 50 minutes from start to finish. It would have been about 35 minutes without the interruptions and without all the chit-chat. How quick and easy was that? And got the program created. That first step of the program, right, was cut out the protein, or build the protein, use hydrochloric acid, cut out the coffee. Sherry says, I used to do that as per my training, but after having found your videos, you've helped tremendously to make the assessment more effective, efficient, and effective. Congratulations, Sherry. So glad to hear that. Christina says, love it. Fantastic. Thank you. This is how we do iridology to have it save time in a session, but go deeper and create better rapport. Because with this, yes, we've got the client's symptom. Now we're looking at the eyes. Our intake, we use the eyes as our intake form. The eyes give us the questions we need to ask to connect to the symptoms, right? And that guides the whole process. There's no need to go into every marking we see. When I initially started, I would have assigned a problem to every one of these open and closed lacunae, to every dot, to every thickened fiber. Everything in here would have been notated with an explanation as to what it meant and what you need to do about it. That's not necessary. It's a waste of time and it's overwhelming. We cherry pick what we need to cherry pick, deal with it, and we build from one appointment to the next. How does that feel? How does that feel for you? The idea of being able to laser focus and have your focus directed by what the eyes are showing you. Sound like something you want to do? I'm going to throw this out to you. The next cohort of the Dynamic Iridology Assessment System is starting on September 3rd. And you will find there's more information in the link that I've just put in the chat box. On that website, you'll find out lots of information about the Dynamic Iridology Assessment System course, who it's designed for, which is holistic practitioners or health professionals, anyone who's got that college level anatomy and physiology course under their belt, whether it was through a nutrition program or through a herbal program or registered nurse or naturopath, whatever. And you'll see buttons on that site that will let you schedule a time to speak with me to get your answers, to ask your questions about the course, to get answers about the course, to make sure, to find out if this is the right fit for you. So if the course looks like it's a good fit, then we'll talk about getting you enrolled. If it's not quite the right time, if there's something missing, if it's not, doesn't really fit in with your goals of where you want to go, then we won't talk about getting you enrolled, right? I'm pretty careful with that, never high pressure, always simply, is this the right fit or not? So if that is of interest to you, feel free to grab that link and schedule a time to chat with me. Let's get on it, because September 3rd is going to be here sooner than we know. And with summer, you know how summer goes. It disappears, right? It just disappears. And so let's get on that. I look forward to speaking with you soon. Just before we wrap up, any questions or comments before we're wrapping up for today? Are we good? If you're typing a comment, just use the raised hand icon so that I know to wait for you. I don't see a hand pop up. Sherry says this has been so helpful. Excellent, Sherry. That is great. April is typing in a question. We'll give this a minute to come through. And so is Christina. Will there be another mini session? Christina, I do these little web classes about twice a month. So just watch your emails, including chunk spam and promo, because that's how the algorithm works. And that is where you would find it. April says, any advice on how to implement this when meeting virtually with clients? Nearly impossible to do it well unless you've met with them once to get photographs of their eyes. You will see a lot of people saying they can do iridology virtually, and it's really difficult because to get the quality of eye photos that you saw on the screen is almost impossible to do with a smartphone. And with iridology alone, you've got to be able to control the direction of the light, the amount of the light. And then if you're going to do sclera as well, you've got to have even more control over things. And so really hard to do it completely virtually. I like to see my clients face to face once a year. And once I've seen them once a year, then we can work virtually because I have their photos, right? And those photos are good for pretty much the whole year. All right, Christina's saying, yay, looking forward to the next one. Fantastic, fantastic. You're welcome, April. I hope that helped. It's probably not the answer you were hoping for, but it's the honest answer, right? And so I've had clients try to send me photos, and they're just, when they're from a smartphone, they're just not good enough. A professional camera setup uses a high resolution camera with a macro lens with lighting that is appropriate for doing irises and sclerae. So it's not the kind of camera most people would have in their travel kit, right? Okay, so with that, I hope to see you at the next one of these. Watch your emails for the invitations. And if you are thinking of adding iridology to your skill set and you've got anatomy and physiology under your belt, let's chat. Use that link, get more information about the course, and then book a time to chat with me so we can see if this is the right fit for you and the right time. Have a great evening, and we will talk to you soon. Bye for now.